Good morning, everyone. Our today's lecture is on anxiety disorders, part 7. In the previous lectures, we had discussed about anxiety disorder. Then we had discussed about types of anxiety disorders, that is, separation anxiety disorder, childhood onset social phobia or social anxiety disorder. Then we had discussed about panic disorders, then generalized anxiety disorder, then obsessive compulsive disorder, selective mutism. Now in today's lecture, that is part 7, we are going to discuss about specific phobias. So in continuation with the previous lectures, let's continue our today's lecture, phobias. So now what is phobia? When we talk about phobia, first what comes to our mind? Phobia means excessive fear. Phobia is excessive fear. The term phobia, it means it refers to a group of anxiety symptoms. Phobia means fear, and it refers to a group of anxiety symptoms which are brought on by certain specific objects, certain specific thoughts or situations. Means phobia means excessive fear, which means group of anxiety symptoms. और कब होगा fear उसको? When there is a specific thought or specific situation. Specific phobia, which is it's a unreasonable lasting fear which is caused by presence or thought of a specific object or situation that usually poses actually no danger. Means phobia is a state of excessive fear. इतना ज्यादा डर किसी पर्टिकुलर ऑब्जेक्ट से, किसी पर्टिकुलर सिचुएशन से या किसी पर्टिकुलर थॉट से which actually is unreasonable, उसका कोई लॉजिक नहीं है and it will not pose any danger to that individual. उस डर से उसको कोई हार्म नहीं होगा, but the child, the individual has that fear due to presence of that particular thought or presence of that particular situation or presence of that particular object. Exposure, any kind of exposure to the object or the situation brings about immediate reaction. मीन्स जैसे ही वो इंडिविजुअल एक्सपोज हुआ उस पर्टिकुलर ऑब्जेक्ट से या पर्टिकुलर सिचुएशन से जिससे उसको बहुत ज्यादा फियर है, देन immediately he'll start having anxiety symptoms. He'll go through anxiety symptoms. He'll start having nervousness or he'll start avoiding that object or that situation immediately. Means phobia हमने बात करी, it's a state of excessive fear which is brought on by presence of particular thought or object or situation that in reality causes no danger to the individual. Means उसको इतना ज्यादा डर लगता है उस particular situation से या particular object से कि वो उसको avoid करने की कोशिश करता है. एक्चुअल में वो ऑब्जेक्ट या सिचुएशन उसको कोई हार्म नहीं पहुंचाएगा, लेकिन उसको बहुत ज्यादा डर लगता है और इतना ज्यादा डर लगता है कि he start having anxiety symptoms. Children with phobia avoid specific objects or situations that reliably trigger physiological arousal. Now, children with phobias, what they'll do, they'll avoid those particular specific objects. They'll start avoiding those situations that trigger their physiological arousal. Arousal is it's a physiological or psychological state of being awoken. The fear is excessive and unreasonable and can be cured by the presence or anticipation of the feared trigger. Means उसको इतना ज्यादा excessive fear होता है कि वो उस particular situation या thought की presence में वो और ज्यादा increase हो जाता है और ज्यादा triggered हो जाता है या उसके सोचने से ही वो इतना trigger हो जाता है and the individual start having anxiety symptoms. Means उसका fear इतना ज्यादा डर है, उसको इतना ज्यादा excessive है उसको वो fear कि वो उस थॉट की प्रेजेंस से ही उसका फियर इतना ट्रिगर हो जाता है या वो उसके बारे में सोचता भी है ना, उस चीज के बारे में इमेजिन भी करता है, एंटिसिपेट भी करता है, तो भी उसका फियर इतना ज्यादा ट्रिगर हो जाता है कि द इंडिविजुअल स्टार्ट्स हैविंग एंजाइटी सिम्टम्स. द चाइल्ड स्टार्ट्स डेवलपिंग nervousness. He starts having symptoms of anxiety immediately. Neither obsessions nor compulsions are associated with the fear response. No obsessive compulsive disorder is associated with the phobia. There are no obsessions, there are no compulsions which are linked with the phobia, which are linked with the fear. There is no relation with obsession and compulsions. Phobia only rarely interfere with social, educational or interpersonal functioning. हमने जो बाकी anxiety disorders पढ़े थे, they interfere with your social, educational, interpersonal functioning. But phobias, in very rare cases, phobias, the fear, interfere with the social functioning, educational functioning, or interpersonal functioning. In minority of the cases, phobia can interfere, otherwise it doesn't interfere with the social, educational, or interpersonal functioning. Assault by a relative and verbal aggression between parents can influence the onset of specific phobias. Now, ऐसी कौन सी circumstances हैं जहां पे phobia develop हो सकता है, which can lead to the onset of specific phobias? That is, one situation can be assault by a relative. Now, assault can be sexual assault, any sexual abuse, physical assault by any relative, or verbal aggression between parents. घर में है बच्चा, पेरेंट्स के बीच में कॉन्फ्लिक्ट देख रहा है, वो देख रहा है कि पेरेंट एक दूसरे को अब्यूज कर रहे हैं, चिल्ला रहे हैं, देन दैट वर्बल अग्रेशन, या एक दूसरे की तरफ मिसबिहेव कर रहे हैं, सो दैट अग्रेशन, दैट वर्बल अग्रेशन बिटवीन द पेरेंट्स, दिस कैन इन्फ्लुएंस द ऑनसेट ऑफ स्पेसिफिक फोबिया. मींस बच्चे के अंदर इतना ज्यादा डर डेवलप हो जाएगा इस चीज से, if the child is assaulted by any relative or he has witnessed verbal aggression between his parents, then it can lead to onset of specific phobias. The parents of phobic children should remain calm in the face of the child's anxiety or panic. Now, when the child is diagnosed with having a phobia, then what should parents do? They should remain calm in front of the child, or when the child is anxious, or when the child is getting panic in that particular situation, जिस सिचुएशन से उसको बहुत ज्यादा फोबिया है, और उस सिचुएशन में अगर बच्चा बहुत ज्यादा एंशियस हो रहा है, पैनिक हो रहा है, then it's the duty of the parents to remain calm during that moment. Parents who become anxious themselves may reinforce their child's anxiety. Means, what should parents do? They should remain calm when their child is getting anxious, when their child is getting panic or anxious, then those parents should remain calm in front of their parents. In fact, उन situations में जहाँ parents खुद anxious हो जाते हैं, then it puts a negative impact on the children and these children become more anxious. The prevalence of specific phobia in childhood is 0.5 to 2%. Prevalence rate is in children is 0.5 to 2%. Now, diagnostic criteria for specific phobias. Before that, I'll explain you something else, that there are different kinds of specific phobias. क्योंकि हमने बात करी that a specific phobia, a specific fear, it is caused by presence of certain thought or specific situation. So according to that, there are different types of specific phobias which are based on the object or the situation which is feared. Means there are different types of phobia which are based on different types of objects and situations. जिन objects से, जिन situations से बच्चे को डर लगता है, so according to that, there are different types of the phobias, like animal phobias. Example, fear of dogs, fear of snakes, fear of insects, fear of mouse. Animal phobia means the child is having fear of the animals, and most common fear is fear of the dogs, snakes, insects, mouse. And जो animal phobia होता है, it's the most common specific phobia. Means majority of बच्चों को इन्हीं से डर लगता है. They have fear of animals. Now, if we talk about situational, circumstantial phobias, means कि situation से डर लगता है, then it involves situation like flying, riding in a car, or public transport, driving, going over the bridges or in tunnels, or of being in closed in place like an elevator. Means कुछ बच्चों को डर कहाँ पे लगता है? लिफ्ट पे चढ़ने से डर लगता है, एलिवेटर पे डर लगता है, एरोप्लेन में डर लगता है. दे हैव फियर ऑफ राइडिंग इन द कार, पब्लिक ट्रांसपोर्ट में, ड्राइविंग में, ब्रिज के ऊपर जाने से डर लगता है, टनल में जाने से डर लगता है. सो सिचुएशनल फोबिया. देन अगर हम बात करते हैं फोबिया ऑफ द नेचुरल इन्वायरमेंट, देन इसके एग्जांपल हो सकते हैं आंधी तूफान से डर लगता है, फियर ऑफ द स्टॉर्म्स, फियर ऑफ द हाइट, फियर ऑफ द वाटर. हाइड्रोफोबिया मीन्स फियर ऑफ द natural environment phobias. So till now we have discussed about types of phobias which are based on particular object or situation. In that we had discussed about animal phobias. Example, fear of dogs, snakes, mouse. Then situational phobia, fear of flying, riding in the car, public transport में travel करने से, driving से, traveling over the bridges, going in the tunnels, or fear of going in the elevators or in the lift. Then natural environment phobias, इसके example हैं fear of the height, water, storms, fear of going at the higher places. Then if we talk about blood injection injury phobias, then this involve fear of seeing the blood. कुछ लोगों को blood देखने से डर लगता है, fear of getting injured, ये मेडिकल टेस्ट से डर लगता है, इंजेक्शन से डर लगता है, या मेडिकल के जो प्रोसेस होते हैं, टेस्टिंग्स होती हैं, इन्वेस्टिगेशन होते हैं, उससे डर लगता है. देन अदर फोबिया में आ जाएगा फियर ऑफ लाउड साउंड, तेज आवाज से डर लगता है. और कुछ बच्चों को क्लाउन क्लाउन से डर लगता है, या गिरने से डर लगता है, फियर ऑफ फॉलिंग डाउन, फियर ऑफ लाउड साउंड, and many other phobias. A person can have, a child can have, an individual can have more than one specific phobia. ऐसा नहीं है किसी पर्टिकुलर इंडिविजुअल का, किसी बच्चे को एक ही फोबिया होगा. He or she can have multiple phobias. He or she can have more than one specific phobia. Now, diagnostic criteria for specific phobias. How we will diagnose a case of specific phobia? Marked fear or anxiety about specific object or situation. This we have discussed about in types of specific phobias. Excessive fear, and then he starts developing symptoms of anxiety. Marked fear or anxiety about a specific object or situation. Example, flying, height, animals, receiving an injection, seeing blood. This we had discussed in the types of phobias, means the child is having fear of traveling over the bridge, flying, fear of animals, fear of injections, blood, etc. Now, note, in children, the fear or anxiety may be expressed by crying, tantrums, freezing, or clinging. Now, how we can diagnose that a child is having a fear? वो कैसे represent करेगा अपने fear को? कैसे express करेगा कि उसको डर लग रहा है? The child will start crying, रोने लग जाएगा, अपने पेरेंट्स से चिपक जाएगा, clinging ही, फ्रीज, जहां बैठा वहीं टिक जाएगा कि मैं हिलूंगा ही नहीं यहाँ से. टैंट्रम्स, टैंट्रम हम डिस्कस किया था, जब बच्चा अपनी बात को प्रॉपर्ली एक्सप्रेस नहीं कर पाता है ड्यू टू लिमिटेड वर्बल कैपेबिलिटी. So he will start having tantrums, he'll start throwing tantrums, he'll start crying, he'll start clinging to the parents. So in this way we can judge that a child is having fear or anxiety. So basically in children, this fear or anxiety is expressed by crying, by throwing tantrums, freezing, or clinging. So this is one way to diagnose a case of specific phobia. Now, second, the phobic object or situation almost always provokes immediate fear or anxiety. Now, it is very common. जिस चीज से उसको डर लग रहा है, जिस ऑब्जेक्ट से उसको डर लग रहा है, जिस सिचुएशन से उसको डर लग रहा है, that particular object, that particular situation should almost provoke immediate fear. Means अगर उसको डर लग रहा है ब्लड से, so ब्लड देखते ही उसको एकदम से डर लगना चाहिए. That blood, yeah, the sight of that blood or the sight of the injection, or on seeing the dogs or cats or snakes, that thing should immediately provoke fear or anxiety in the individual. Then we can say that it's a case of specific phobia. So that the phobic object or situation should almost always provoke immediate fear or anxiety. Next, the phobic object or situation is actively avoided or endured with intense fear or anxiety. Now, the phobic object or situation is avoided or endured with intense fear or anxiety. या तो इंडिविजुअल जो बच्चा है इसको बार बार उस ऑब्जेक्ट को अवॉइड करेगा, जिस चीज से इसको डर लग रहा है, जिस सिचुएशन से इसको डर लग रहा है, ही विल स्टार्ट अवॉइडिंग दैट सिचुएशन. और अगर वो अवॉइड नहीं कर पा रहा है, और एंड्योर्ड मीन्स गो थ्रू, अगर वो अवॉइड नहीं कर पाता है देन ही विल गो थ्रू विद इंटेंस फियर और एंजाइटी. या तो वो अवॉइड कर देगा उस सिचुएशन को, सब्जेक्ट को. मान लो उसको पता है कि मुझे ब्लड से डर लगता है, तो वो हॉस्पिटल जाएगा ही नहीं एंड ही विल स्टार्ट अवॉइडिंग. बट अगर वो अवॉइड नहीं कर पाया और उसको जाना पड़ा हॉस्पिटल ड्यू टू सम रीजन, देन ही विल स्टार्ट हैविंग anxiety symptoms. He will have intense fear and he will start having anxiety symptoms क्योंकि उसको तो बहुत डर लगता है. That blood will provoke fear in the individual and he'll start having anxiety symptoms. So the phobic object or the situation is actively avoided. या तो वो उसको avoid करेगा बहुत ज्यादा, और अगर avoid नहीं कर पाया then he'll go through with intense fear and symptoms of anxiety. So this is another way of diagnosing a case of specific phobia. Now next D, the fear or anxiety is out of proportion to the actual danger posed by the specific object or situation and to the socio-cultural context. The fear, anxiety or avoidance is persistent, typically lasting for 6 months or more. Now, अब जिस ऑब्जेक्ट से, जिस सिचुएशन से उसको डर लग रहा है, तो क्या साइकिल रहेगी? या तो उसको डर लगेगा, देन डर लगेगा तो उसको उसमें सिम्टम्स आएंगे नर्वसनेस के, एंजाइटी सिम्टम्स आएंगे, या फिर वो सिचुएशन को अवॉइड करेगा. तो ये जो पूरे तीनों स्टेप्स है, फियर, एंजाइटी और अवॉइडेंस, ये परसिस्टेंट है एंड दे लास्ट फॉर एटलीस्ट 6 मंथ्स और मोर. ऐसा नहीं कि कभी बच्चे को डर लग गया ब्लड देख के एकदम से तो हम उसको फोबिया में इंक्लूड कर लेंगे. नो, अगर उसका ये डर, उसकी ये एंजाइटी, उसका ये अवॉइडेंस persistent है at least for 6 months or more than 6 months, then we can diagnose it as a case of specific phobia. Means that fear, that anxiety and that avoidance of that situation, of that object, if it is persistent and if it is lasting for 6 months or more than 6 months, then it is diagnosed as a case of specific phobia. F, the fear, anxiety, or avoidance causes clinically significant distress or impairment in social, occupational, or other important areas of functioning. Now, अब उसका जो डर है, जो उसके एंजाइटी सिम्टम्स हैं, या जो अवॉइड कर रहा है उन सिचुएशंस को, उसकी वजह से that things they are causing distress in his or impairment in his social functioning, in his occupational functioning, or in his other important areas of the functioning. दैट इज वेरी ऑब्वियस. हर एंजाइटी डिसऑर्डर, अगर कोई भी एंजाइटी डिसऑर्डर किसी इंडिविजुअल के डे टू डे रूटीन में, उसकी सोशल फंक्शनिंग में, उसके ऑक्यूपेशन में इम्पेयरमेंट कर रहा है, देन if it is causing distress, then it is a case of that anxiety disorder. So if the fear, anxiety and the avoidance of the situations or the objects, if it is causing distress or impairment in social functioning, occupational functioning, or other important areas of functioning, then it's a case of specific phobias diagnosed. Now, the disturbance is not better explained by the symptoms of another mental disorder. This diagnostic criteria we have discussed in almost every anxiety disorder कि the disturbance, जो भी उसकी impairment हो रहा है social functioning में, occupational functioning में, that is not due to any other mental disorder, like including fear, anxiety and avoidance or situations associated with panic-like symptoms. Panic disorder में भी वो avoid करता है social gatherings को, or other incapacitating symptoms. Objects or situations related to obsessions as in obsessive compulsive disorder, remainders of traumatic events as in post-traumatic stress disorder, separation from home or attachment figures as in separation anxiety disorder, or avoidance of social situations as in social anxiety disorder. So if the disturbance is not explained by any other mental disorder, then it's a case of specific phobia. Now, specify if code based on phobic stimulus. Animals that we've discussed, fear of spiders, insects, dogs, natural environment, heights, storms, water, blood injections, needles, medical procedures, situational fears, aeroplanes में, elevators में, lift में, enclosed places में डर लगता है उसको. Other phobias like situations that may lead to choking or vomiting, loud sounds, costume characters, clowns, इनसे डर लगता है. Now, ये हमने डिस्कस कर लिया डायग्नोस्टिक क्राइटेरिया क्या होता है स्पेसिफिक फोबियाज का. देन वी हैव डिस्कस दैट diagnostic criteria, definition of specific phobia, then we had discussed about the types of specific phobias. अब हमने ये तो बात कर ली. अगर हम इसके सिम्टम्स की बात करें तो क्या आएंगे उसके अंदर? बहुत कॉमन सिम्टम है, द चाइल्ड द इंडिविजुअल विल हैव एक्सेसिव फियर ऑफ द स्पेसिफिक ऑब्जेक्ट और द सिचुएशन. डेफिनेशन में ही सिम्टम है. सिम्टम भी क्या रहेगा उसका? द चाइल्ड विल हैव एक्सेसिव फियर ऑफ अ स्पेसिफिक ऑब्जेक्ट और द सिचुएशन. देन he will start avoiding those situations. अगर avoid नहीं कर पाया, then he will start having anxiety symptoms, nervousness. और anxiety symptoms क्या होंगे? Panic attacks, nausea, diarrhea, excessive sweating, trembling of the hands and the feet, numbness, tingling, breathing problems, shortness of breath, and dizziness. Then anticipatory anxiety. He'll become nervous, and the children will express their anxiety by crying, clinging to the parents, or by throwing a tantrum. Now, the exact cause of specific phobia is not known, but ऐसा माना जाता है that most appear to be associated with traumatic experience. Exact cause तो नहीं पता क्यों होता है ये, but it is known that it is due to traumatic experience. So this was all about specific phobia. Management की अगर हम बात करते हैं इसकी, then systemic desensitization. It's a form of behavior therapy that gradually exposes the patient to the fear-inducing situation or the object. Now, how we will manage specific phobia? क्योंकि cause का कोई known है ही नहीं. जो known है वो यही है कि due to some previous traumatic event. Now, how we'll manage? So there's a therapy which is known as systematic desensitization. It is a form of behavioral therapy. उसमें क्या होता है? The individual is gradually exposed to the fear-inducing situation or the object. जिस object से जिस situation से उसको बहुत डर लगता है, the individual is gradually exposed to that situation, while simultaneously teaching relaxation techniques for anxiety management. Means जिस object से जिस situation से individual को बच्चे को बहुत डर लगता है, the individual is exposed to that situation. और उसी टाइम पे parallelly हम उसको ये टेक्निक बताते हैं कि how to get relaxed, how to lower down your anxiety, how to manage your anxiety. So systematic desensitization. Systematically हम उसको समझाते हैं how to get relaxed and how to lower down your anxiety. And the individual is gradually exposed. मतलब उसका एक तरह से बोला जाए तो हम उसको उसके डर से सामना कराते हैं. जिस चीज से, जिस ऑब्जेक्ट से, जिस सिचुएशन से उसको डर लगता है, उसी से उसको एक्सपोज कराते हैं और पैरेलली साइमल्टेनियसली उसको ये सिखाते हैं how to relax and how to lower down your anxiety, how to manage your anxiety symptoms. Successful repeated exposure leads to extinguishing anxiety for that stimulus. Repeatedly उसको expose करते हैं, then which leads to extinguishing anxiety for that stimulus. जब उसको gradually बार बार repeatedly expose करते हैं उसकी उस डर से, उस particular object से, then gradually that anxiety it gets extinguished. When phobias are particularly severe, SSRI can be used with behavioral intervention. जब phobias बहुत ज़्यादा severe हो, then what we can do? SSRI means selective serotonin reuptake inhibitors. It's an effective therapy for many anxiety disorders. SSRI, selective serotonin reuptake inhibitors. It can be used when phobias are severe. Low dose SSRI treatment may be especially effective for some children with severe refractory choking phobia. So basically, how we can manage specific phobia? By specific desensitization. Systematic desensitization, जिसमें हम उस बच्चे को एक्सपोज कराते हैं उसी के डर से, एंड जब बार बार उसको एक्सपोज कराते हैं रिपीटेडली, then his anxiety symptoms get extinguished. And then another therapy is SSRI when phobias are particularly severe. So this was all about specific phobias. इसमें हमने डिस्कस किया what is specific phobia, then types of specific phobias, then symptoms, then diagnostic criteria and the management. So this was all about specific phobias. Thank you.